welcome to our 5th annual Federal Employee Health Benefits Forum. Usually we're with our friends over at Holiday Park. We are, of course, on Zoom because of the continuing COVID-19 situation, but we're very psyched to have drawn together some great speakers and all of our friends. Federal Benefits Open Season for 2022 is currently underway, but please mute your phones if you would. The open season is currently underway. It will end on December the 13th. So as you know, in prior years, we've been at the Holiday Park Senior Center, and we look forward to getting there together again with all our good friends from Maryland NARFE and the representatives from all of the insurance providers who join us. Thrilled again, though, to have a phenomenal panel of experts this year. Before we begin, I wanted to share a few high-level updates relating to the federal workforce. As you know, I'm proud to represent more than 88,000 federal workers and retirees who live in the 8th CD. I'm dedicated to ensuring that all of our federal workers and retirees are treated with respect and receive all of the benefits that they deserve and have bargained for. President Biden has proposed an average 2.7% pay raise for federal employees in 2022, which is well above the 1% raise for civilian employees that was implemented in the last administration. I was proud to once again join my friend and colleague, Chairman Congressman Jerry Conley from Virginia, in introducing the FAIR Act this year, which would provide federal workers with a 3.2% average pay raise in 2022. I do believe that after everything we've been through, federal workers deserve a robust pay increase, especially after the very modest 2021 increase. And I will be closely tracking this issue and pressing for progress in the weeks ahead. As many of you are well aware, in 2022, there will be a 5.9% cost of living adjustment for federal retirees under the Civil Service Retirement System, and a 4.9% increase for federal retirees who are under FERS, the Federal Employment Retirement System, Federal Employee Retirement System. I'm a proud co-sponsor of the Equal COLA Act, which would fix the two-tiered system and ensure that FERS retirees receive the same COLA adjustments as other federal employees. Finally, I'm heartened by the Biden administration's efforts to inform federal employees of their union rights and to encourage people to engage in workplace organizing. I look forward to continuing to partner with the new administration to protect and empower our federal workforce and retirees. Turning to today's panel, we've assembled a fantastic group of experts who are ready to discuss the various federal employee health benefit plans and other options available to you. We've asked each speaker to speak for 10 minutes with a minute or two for follow-up questions from me. Unfortunately, I was hoping we'd go to 9:50. It looks like I've got to end at 9:40. I'm going over to the White House where we're going to be doing a signing ceremony for the infrastructure legislation. So I've got to leave a little bit early. So I'm going to ask everybody to be brief and cogent, as I know you will be. If we can keep everybody to 8 or 9 minutes, I think we'll be able to stay on course. I start by welcoming Ed DeHarde, who serves as the Deputy Associate Director of Healthcare and Insurance, Federal Employees Insurance Operations at OPM. Ed has worked for OPM for more than 20 years. Before joining, he worked in the disability branch of the Social Security Administration. So Ed, you get to go first, and thank you so much for joining us.
Thank you, Congressman Raskin. It's a great pleasure to be here on this panel with these other great experts. The Federal Benefits Open Season for the 2022 plan year is for health insurance under the FEHB program, dental and vision insurance under the FedVIP program, and the flexible spending accounts under FSA Feds. It runs from November 8th through December 13th, 2021. The open season gives federal employees and other eligible individuals the opportunity to review their plans, make changes, and enroll in one of the 275 FEHB plan choices for 2022. This is also a time for annuitants to reevaluate their plans and decide if they are optimally covered. Every year, on behalf of the 8.2 million enrollees, OPM focuses on offering quality and affordable health, dental, and vision benefits to federal employees, annuitants, and their families. For the 2022 plan year, we have once again succeeded in meeting this goal. Throughout the national pandemic, OPM has worked with our FEHB carriers to ensure Their enrollees have ready access to COVID-related benefits with no cost sharing. FEHB carriers have risen to the challenge, providing quick solutions to provide COVID-19 testing and vaccines, telehealth, and mental health benefits to our federal enrollees, and encouraging enrollees to get vaccinated, with many offering incentives to those who do. We thank them for their commitment and their support. The overall average increase in rates for federal employees and annuitants, excluding postal actives for 2022, is 2.4%. And this is less than what Congressman Raskin just mentioned in terms of what's recommended for the pay increase, which is a good thing. The average government contribution is slated to increase by 1.9%. The average enrollee share without movement would be 3.8%. This is very important. This is an exchange which allows you to shop for the healthcare that optimally meets your needs. And when we announce the premium increase every year, that's before movement. It's important that you look at the options that are available to you and choose the one that is the best value and the most cost effective for you. Every year we see some movement, and we see the announced premium increase is not as high after the movement. People go to better value plans for them, but we could see more movement, we could see better shopping. We need you to look at what's available and do what's in your best interest. A rate chart is offered on opm.gov for you to go look at what the prices are for each of the plans for you. As I said, we have a 2.4% average premium increase. This compares quite favorably to others. CalPERS has announced, the California Retirement Program has announced a 4.8% overall increase. And PricewaterhouseCoopers Health Research Institute has projected a 6.5% growth rate in medical costs for calendar year 2022. So we're doing quite well in terms of the price of the benefits that are offered to you. The major cost drivers we've seen this year are specialty drugs, increasing costs of specialty drugs, which are innovative in providing better care, but raising costs. Medical pharmacy, that is drugs that are billed at the medical provider's office, chronic illness costs, and advances in medical technology and innovation. The coronavirus pandemic has added approximately $1 billion of cost, as our last estimate, are 2% of 2020 claims. So that's been very expensive as well. There are 275 plan choices available in the FEHB program in 2022. 18 fee-for-service plans are available. 14 nationwide fee-for-service plans are open to all. All 14 of those are available to you. There are 4 that are only open to some, such as Compass Rose, Foreign Service Benefit Plan, Rural Benefit Carriers, and Panama Canal. There are 192 HMO plan choices, 37 high deductible health plan choices, 2 of which are nationwide, 28 consumer-driven health plan choices. In the Washington, D.C. metropolitan area, there are 38 plan choices available to you to review and consider. And it's very important that you go look and make the best choice. There's one new carrier in FEHB for 2022, Health Keepers Inc. in Virginia. So that's another Virginia option there. And there are 23 new plan choices with existing FEHB carriers in 2022. Medicare is a thing that comes up each year at these. And I know Tammy, who's on the panel, the NARFE population has a lot of interest in that. And Walt will have a lot of good information on that too. But FEHB carriers continue to address and respond to the needs of the annuitants, who are also Medicare beneficiaries. There are FEHB plan choices that offer some type of Medicare B incentive, either through copay, coinsurance, or deductible waivers, or Part B premium reimbursement. The FEHB plan comparison tool makes this information more readily available to enrollees and identifies plan choices with the Medicare B incentive. The plan comparison tool features a display that allows individuals to see exactly what they're expected to pay if they have both Medicare A and B as their primary coverage and FEHB as their secondary coverage. And you want to look, we have some new plan choices that are available there. Other things that we have done with regard to the benefits this year, we continue to emphasize prevention of the opioid epidemic. We've created a new benefit in the prescription drugs. We're starting in 2022. FEHB carriers will have a process to review all expiring prescription prior authorizations, so you won't arrive at a pharmacy counter and find out your drug is not approved. We've addressed low value care by asking plans not to cover United States Preventive Services Task Force D recommended items. We've increased coverage for certain medical foods. We've provided coverage for fertility preservation in FEHB members with possibility of iatrogenic infertility. And a big thing that's happening in 2022 is implementation of the No Surprises Act. And so members will no longer be responsible for differences between the bill charge and the allowance for certain providers. There's an important notice on surprise billing in every FEHB program brochure, which gives you information on your rights under this new coverage. And as Congressman Raskin said, we don't have a lot of time, so moving on very quickly. FedVIP this year, the average premium increase for over plan year 2021 will be only 0.81%. And for vision plans, it will be 0.95%. So almost no premium increase on average in these programs. There are 12 dental carriers that provide 23 dental plan options. There are 5 vision carriers that provide 10 nationwide options. So it's important that you look there as well for the plan that best meets your needs. In the flexible spending account arena, as in the past, federal employees are encouraged to consider the tax savings available through the federal flexible spending account program. Setting aside the amount projected to spend in out-of-pocket health, dental, and vision expenses in a flexible spending account saves federal employees money. Participants may now carry over up to $550 of unused amounts in their healthcare flexible spending account and limited expense flexible spending account. These amounts recently increased. IRS released guidance on Thursday, and our plan document already accounts for that. And we will be making adjustments to the website in short order so that you can allot up to the IRS amount. In addition, in response to the COVID-19 pandemic, legislation and IRS flexibilities, we did special election periods during the last cycle, which have allowed you to have additional carryover amounts. We extended grace periods, etc. So again, the key dates, open season will end this year on December 13. It's very important that you get out there and make your choices. And last thing I was going to give you, but I'll come back to it. I'll give you the open season access numbers for annuitants to make their changes and how to make your changes. And I'll do that following the other presentations. Thank you very much. Jamie, you're on mute. Sorry.
Yep. Thank you very much, Ed. And can you also make sure people know where to find the comparison tool?
Yes. Yes.
Good deal.
And it's on opm.gov. We have a banner up there now for open season. If you click on that banner, that will rapidly take you into where the open season pieces are. It's up year round. You click on the OPM website, then healthcare and insurance or health, and there's a whole flow down of things that you can select from.
Awesome.
But I can even get more granular as we move on.
That's great. Thank you so much, Ed, for that great presentation. I want to welcome my friend Tammy Flanagan, who's a benefits expert for NARFE. She spent 30 years helping federal employees take charge of their retirement by understanding all of their benefits. She provides individual counseling as well as online training for the NARFE Association, Plan Your Federal Retirement, and the Federal Long-Term Care Insurance Program. Welcome, Tammy. The floor is yours for 10 minutes.
Thank you, Congressman, and thanks for inviting me. And I'm happy to be here with both Ed and Walt. I feel very honored, so appreciate the opportunity. So welcome everyone, and to open season, I'm glad that at least people are coming out to learn about the different health plans. And as Ed mentioned, with that many choices, sometimes it's paralysis by too much analysis and we throw our hands up and say, we'll just stay with what we've known. But what I found out over the weekend is that Medicare is now going up. As much as we've kept the health benefit premiums down for FEHB, you may have heard this by now, Medicare is going up 14.5% for Part B in 2022. So I have a feeling a lot more retirees and soon to be retirees are going to start really rethinking their federal health plan when they think about adding Medicare Part B to that whole picture of their health insurance. So one of the things that retirees can do, and people getting ready to retire, I know we're going to have a lot of retirees the end of this year who are going to be thinking about these things as well, is that they can think about adjusting their federal health plan. As you heard Ed say, there's many plans now that offer incentives, excuse me, for retirees to enroll in Medicare Part B. So even though the federal health plans don't require it, you can go the rest of your life and have Blue Cross Standard or Compass Rose, whichever plan that you're in. But if you look at all the plan options, you're going to find that there's quite a few plans, especially going into next year, that will offer you a reimbursement for some, maybe not all, but some of your Medicare Part B premium that's going to lower your overall cost of health insurance. You'll also find that many of the plans offer what I think, Walt, you might have coined this name, wraparound coverage, which means when you have a doctor's appointment or you go for lab work or you're in the hospital, if you're retired with Medicare and your federal health insurance, Medicare is going to be your primary payer. So Medicare gets billed first, then the bill goes to your FEHB plan as secondary payer. And many of the plans will say, wow, this is great. We've saved a lot of money. So we're going to waive your deductible, your copayment, your co-insurance. So you'll get a statement from your health plan or from Medicare, actually, once you're retired, that says you owe zero. So that's pretty nice. We're used to getting something where it says you still owe $150 or $950. So having that wraparound benefit, even though you're paying extra for Part B, you can save as much as you're paying, especially in years when, I hate to say it, but sometimes as we get older, we start scheduling our social life around our doctor's appointments. So you want to make sure that you have adequate coverage for chronic illnesses that might happen in our later years. And you might think, well, why don't people just wait till they're 85 to take Medicare? Why get it while I'm still healthy and hiking and going on ski trips? Well, it's because if you wait too long to sign up for Medicare, every 12 months you delay enrollment once it becomes primary payer, you're going to pay a 10% surcharge that adds up. I was just talking to a woman last week who didn't sign up when she was 65. She retired at 55 and she's now 78 and she wants Medicare Part B. Well, 13 years, that's 130% surcharge. It's going to be cost prohibitive. So we're looking at different options to help her figure out what's going to be the best option for her going into 2022. So at NARFE, our members can call in and they ask us to help them sort out the options. We never tell you what to do, but sometimes it's nice to talk it over with somebody who can kind of show you the pros and cons. We have all these programs that Ed talked about, OPMs, and Walt's going to tell you about the Checkbook guide. So there's a lot of tools that are out there to help you narrow down those choices. So when I'm helping someone figure out what do I do for next year, I kind of do it a step by step. I say the first step is look at what you're spending already on healthcare. What did you do in 2021? I keep in my office, I have a little folder that has all of our statements, and every year that goes by, that folder gets thicker. Unfortunately, I qualify for Medicare next year, so who knows what's going to happen at that stage in life. But I can look at that folder and see, here's what I spent on prescriptions out of pocket. Here's what we spent on doctor visits or lab work or any kind of healthcare that we received. And what's kind of nice is, every plan, doesn't matter which one, they all cover preventative care if you stay within the plan's network. So most of your out-of-pocket expenses are your prescription drugs, any type of specialist care that you receive, anything outside of your preventative lab work or the screenings that we get every year, that we're supposed to get every year to maintain our health. So that's one of the things we do is we look at those current expenses. Then we say, like my husband might need knee replacement. So we know that's on the horizon. So we're thinking, what are the things we're looking at that we're going to need next year? I was talking to someone the other day. It's very important for her to be able to see a chiropractor. And I was looking at all the different health plans, and some of them give you no chiropractic care. Some of them give you 40 annual visits as part of the health plan. So there's a big difference between the plans if you know a specific need that you have. So you can look at those things. I was even seeing that some of the plans cover massage therapy. Who wouldn't like that as a health benefit? So you want to look at the special benefits that might be outside of what Medicare covers, but that can be important to you as part of your healthcare regimen. So we look at this year, we look at next year, then we look at our zip code. You know, even though there's 200, what did Ed say, 200 and some plans, 75 plans in the whole program, we don't have that many. You know, we might have 30 to pick from. So we can narrow it down to those 30. From there, we can narrow it down to what's important to us. Like if we're looking for Medicare incentives, we can narrow it down to the ones that provide those incentives. If we are looking for certain doctors that are participating, we can narrow it down to that. Or if it's specific needs that we're looking at as well. So I say, you know, let's narrow it down, get it to our top 3 or 4, use these tools that are out there, the checkbook guide, the OPM guide, that's going to help you stack things up side by side and compare one plan to the next. Then once you got it down to 3 plans or 4 plans, now you're going to really zero in. You're going to go to that plan website, look at the plan brochure, look at the specific details. Because if you check section 9, if you're on Medicare, section 9 of every FEHB plan brochure talks about coordinating that plan with Medicare. You're going to find that some of the FEHB plans offer what's called Medicare Advantage through the FEHB plan, which means you'll sign up during open season for that particular health plan. And then the second step of your enrollment is to sign up for that Advantage option. What does that give you? Well, you have to check the plan, but in many cases, it gives you that wraparound benefit we talked about. It might give you a health reimbursement for your Medicare premium, and it's going to offer you silver sneakers, perhaps gym membership or some type of gym discount program or free coverage as well. So there's some extra perks, they call them, and you can pick those up by joining that Medicare Advantage option, but yet you still have the FEHB as your underlying plan. So most of the ones that offer the Medicare Advantage have an enhanced network. So you can still use nationwide doctors. You're not necessarily going to be limited to the doctors in your neighborhood. You might be able to be a snowbird, like I live in Florida, and a lot of people live down here, you know, half the year, and up in the northern part of the country the other half of the year. And some of these plans will work well for you. So don't be limiting your choices to just one brand of healthcare. We have a lot of good choices. And I've always hear Walt say this, that you can't pick a bad plan. You know, they all have comprehensive coverage, catastrophic caps on their out-of-pocket expenses. So you're going to do fine no matter which one you choose. And as we all know, every year there's another open season. So if you're not really happy with the plan you have, you can always switch around. And as the congressman said, I've been doing this for a number of years, and I've used my own family as guinea pigs. So we've tried almost every health plan that we can get enrolled in, and I want to see, how do they work? How do they work for our family? And how do they work for other people? And I try to think about those things as I'm helping people discern the pros and cons from the different plans. And I really can tell you, I've never made a bad choice. And we've tried probably 15 different plans over the years, and they've all worked out well. And next year, we're going to be facing that Medicare decision as well. So I'm really zeroing in on those Medicare benefits for the different plans to see which one's going to work best. Now, once you've narrowed down your choices and you said, okay, I think I found the plan that I want, then the next step is, do I need dental coverage? Do I need vision coverage? Look at your plan. You might have, like one of the health plans we have right now has a vision benefit. So we get a once a year eyeglasses, we get a once a year eye exam included with our health plan. So we don't necessarily need a secondary or a supplemental vision plan. But if your health plan doesn't offer that, the vision plans are very inexpensive. Like Ed was saying, they went up less than 1% for next year. So you're not going to see a big price increase on those plans. And same thing with the dental plans. They're a little bit more pricey because your dental work can add up to thousands of dollars. So you want to look at a plan that's going to meet your needs as far as dental care as well. Whether you need a high option plan with unlimited benefits or a standard option plan that gives you more preventative care and maybe takes care of a filling or two once in a while. So that's how I tell people how to choose a health plan, is just kind of break it down. You know, try not to be overwhelmed by the enormity of the options that you have and the things you have to choose from. But don't just stick your head in the sand, because if you do, you're going to miss out on savings. You're going to miss out on some of these benefits. So I really think open season is an opportunity that we all need to take advantage of. And it's, I know for some people, not the most fun thing in the world to do. I know people laugh at me because I get excited when it's open season. It's something to learn about, something new, but I don't think most people get excited about open season, but it's important. It's kind of like paying your taxes or doing anything else that we have to do. It's maybe going to be an opportunity to learn something new. And in this case, you might actually save some money for next year. So again, thanks for the opportunity. If you're not a member of NARFE, please, feel free to join up, because we do offer a lot of help to especially retirees, but absolutely active employees as well.
All right, Tammy, thank you for that wonderful presentation. We'll keep track of your progress when you're eligible for Medicare, and thanks for making you and your family guinea pigs for the rest of us. I'm pleased to welcome Walt Francis, the consultant and author, Washington Consumer Checkbook's Guide to Health Plans for Federal Employees, editor and writer, and author. So Walt has worked at the Office of Management and Budget in the Office of the Secretary at HHS, and is a consultant to the Center for Medicare and Medicaid Services. He pioneered the comparison of health insurance plans from a consumer perspective as the author of the Checkbook's Guide to Health Plans for Federal Employees. He's testified before Congress on numerous occasions on the performance of the federal employees' health benefits and Medicare program. So welcome, Walt, and I appreciate your being with us.
Thank you. Okay, Tammy and Ed have already covered most of my points, but let me come from a slightly different direction just to support the same underlying points. What you have in open season is a chance to think about your health, to think about your health coverage, and to think about ways to save money if you make smart decisions. We recommend that you look at least 2 or 3 plans. The hard part is figuring out which 2 or 3 to look at, but look at a couple of plans before you decide to stay where you are, and certainly don't change plans till you've looked at a few options. One of the tricks that is turned out to be interesting in recent years is to think about, you're probably in a carrier who's got a family of plans, Blue Cross or GEHA. All right, there are 3 Blue Cross plans. There are 5 GEHA plans. There are 3 Kaiser plans in the DC area. And actually, if you count the Medicare wraparound options that they offer, there's 6 or 7. Aetna offers multiple plans, several of which we rate very highly, as does United. I mean, there's a menu of choices where you could say, well, I'm happy with United. Well, take a look at the other United options. So that's sort of one way to narrow your choice. The other thought I'd have here is that use one of the tools. OPM's tool is very good. Ours is very similar. I think has all the same functions as OPM's tool. And in addition, we tell you how much you're likely to save in plan A versus plan B versus plan C. So if you go online and use our tool, by the way, about 1/3 of all federal employees have free access through their agencies. So go to our website and check whether you have a copy already and didn't know it at guidetohealthplans.org. Guidetohealthplans, one word.org. Our tool ranks plans in order of which one is the least expensive, the second least expensive, and so on. And you're likely to find the plan you're in now is more than halfway down that long list of almost 40 plans. And actually, for people with Medicare Parts A and B, it's actually more than 40 plans, taking into account that there are plans you could join with or without the special Medicare Advantage option that they offer. Okay, so that's why I say Kaiser really has 6 or 7 plans, not just 3 plans. Look at a couple of plans. Look at the brochure of the plan you're in. You can find the brochure. They probably sent you one in the mail, but if they didn't, you can find one on the plan website, on the OPM website, or on the Checkbook website. And as you really want to look at section 2, which tells you how the plan changes this year. I think Tammy mentioned section 9 is the Medicare coordination section for all of those with Medicare. And that change Medicare Parts A and B, or A only, but that changes every year, sometimes dramatically in many plans. So it's well worth checking how do those linkages work. Some of the newer plans, they sort of snuck in the last few years that have their special Medicare Advantage options. If you join the health plan, and step 2 is you join the Medicare Advantage plan, many of those Medicare Advantage plans pay all your doctor bills, all your hospital bills, have a enhanced drug benefit, and pay half or more of your Medicare Part B premium. It's really hard to beat them as a deal. And if you're on Medicare with A and B, it really behooves you to look at 1 or 2 of those plans to see how they work. Another way to think about plan choice is there are categories of plans. There are the national indemnity plans, there are the HMOs, they're local, but there are also plans, both local and national, high deductible plans and consumer-driven plans. So again, back to that point about family of plans, NALC and APWU both offer very good high consumer-driven plans, okay? In addition, there's about 6 or 8 high deductible plans available in the DC area, and all those plans create spectacular savings opportunities. They're not for people who already have another health insurance, including those who have Medicare. So close your ears, you people on Medicare, about this part. But for anyone who's still employed, the ability to put money in tax-free, to let it grow through investments tax-free and come out tax-free if used for healthcare is spectacular. And you get a good start each year in those plans with their contribution to a health savings account paid for by the premium. So you don't have to put up any cash, but you can elect to put up more. I won't say more, except, hey, it's really easy to just pull a brochure and read the description, or read at either, again, OPM's website or the Checkbook website, or there's the occasional NARFE article. I can't recommend NARFE advice too highly, but I would say the same even if Tammy weren't here. There are so many ways to get advice on at least what to look at. So my strong suggestion is look at a couple of plans. There are high-ranking plans in our rankings, our ratings for how much you're likely to pay out of pocket, both for premium and for healthcare costs for people in your circumstance, family size, age, retirement status, with or without Medicare Parts A or A and B. There are all these variables, but taking into account all of them for a given family, we find these spectacular savings, $2,000 a year or more. The majority of federal employees and annuitants could save $2,000 next year. And if you think of it as it's an annual choice, but suppose you keep every year being sure you're in a savings plan equally large over 5 years, that's $10,000. Those are not small numbers, okay? They actually dwarf the annual cost of living increase for those, for annuitants. So there's real money at stake here, and it behooves you to spend a little time looking at plans that you might join. One thing to do if you're not real computer savvy, excuse me, is to get a friend or a neighbor or relative to help you. But I think the websites are all well designed. They get you where you need to go. They're full of advice, and it's silly not to use the things you have the advantage of. One last point about plan brochures. The brochures are written in plain English, and they're all in the same format. So I counseled a woman a few days ago. She had a child with spina bifida who needed an operation, plural actually, to take care of that birth defect. And she wanted, advice on where to look. Well, the first thing I told her is, hey, that's a covered benefit that you're in all these plans. But beyond that, they don't all pay for surgery equally. So go look at a few plans and see, or maybe flip through a bunch of brochures. You could search a brochure with the word spina, okay? Or if to take a different example, if you want, it doesn't matter, knee surgery, hip surgery, surgery is a category. Whatever you're looking for, you can search on that word in the brochure. My favorite all-time example is maternity benefits. Most, but not all plans, and really not too many more than half, offer free or almost free maternity care. Well, why aren't you in one of those plans if you're going to planning on having a baby next year? You should be in one. Well, how do you find which ones offer the best benefit? Compare 3 or 4 brochures side by side and search on the word maternity till it takes you where that benefit's discussed. And there'll be a paragraph or two, and you can get an immediate sense of which plan is likely to pay best. Another key search tool is talking to your physician or physicians. If you have 2 or 3 that you and your family really care about, want to keep, well, the question is, what plan are they in the network of? That is not an exotic thing to find out. You can call the doctor's office and ask. Usually it's you want the business staff, not the doctor personally. And it can get a little tricky because there's multiple Blue Cross plans, for example, that are not FEHB Blue Cross plans. That said, it's not too hard to track it down. You can call the plan and ask, is Doc Sawbones in your network? Or you can go to the plan website and look up whether Doc Sawbones is on their list of preferred providers. Or you can go to use the Checkbook tool in the DC area. We provide also a simple search that tells you whether or not your doctor is in each plan. So you can sort of see which plans have doctor or doctors you use. But there's a caveat in all this. The real question is not what plan network the doctor is in this year, it's next year. So the final key thing to do always is to call the doctor's office and ask. I don't know if we're out of time yet. I suspect we're running up against it. So
yeah, I'm afraid I got to go. Look, this has been extraordinary. Ed and Tammy and Walt have given us advice that can save everybody potentially thousands of dollars, as Walt explains it, over the course of several years, hundreds of dollars just next year, just by taking a little time. And please adopt Tammy's attitude. This is a fun thing to do. Take an hour or two. That's probably all that it would involve to, compare the different plans when you zero in geographically and you zero in on the medical needs of you and your family. So we're very happy to be able to provide this service. I wish we were together back at Holiday Park, but I'm trusting that we will be next year. We've got a bunch of websites and phone numbers which are in the chat space for you to find. And, my office is always here again to help direct you to the right places to get the information that you need. So I want to thank our 3 outstanding panelists for these great insights, and good luck in open season, everybody. I know I'm going to carve out an hour or two myself to go through the different plans and to think about where I am. But although I'm not in the Medicare category yet, but I'm learning and I'm tucking it away for future reference. So thanks, everybody. And I will be in touch soon. All best.